If you've ever wondered about Austedo and how it works, you're not alone. This medication is used for treating conditions like Huntington's disease and tardive dyskinesia. But there's a lot more to it than just these uses. In this video, we'll walk through the top 10 facts about Austedo, breaking down what it is, how it works, and why it could be an important option for people dealing with these challenging conditions. Whether you or someone you know is considering this treatment, these facts should give you a clearer picture of what Austedo is all about. Number 1. What is Austedo? Austedo is a prescription medication known by its generic name deuterium-modified tetrabenazine. It's classified as a vesicular monoamine transporter 2 VMAT2 inhibitor, which means it helps regulate neurotransmitters in the brain. It was developed specifically to manage involuntary movements, which are common in conditions like Huntington's disease chorea and tardive dyskinesia. What makes it stand out from older treatments is its unique formulation, which helps reduce side effects and offers a more targeted approach to treating these disorders. The medicine works by adjusting the levels of certain chemicals in the brain, making it easier for people to manage their symptoms. Approved by the FDA in 2017, Austedo has quickly become an important option for those suffering from movement disorders. Whether you're familiar with the condition or new to the topic, it's clear that Austedo offers a specialized approach to managing these complex neurological issues. Number 2. What does Austedo treat? Austedo is primarily used to treat two major conditions: Huntington's disease chorea and tardive dyskinesia. Huntington's disease is a neurodegenerative disorder that causes progressive motor dysfunction, and chorea refers to the involuntary jerky movements often seen in those affected. Austedo helps manage these symptoms, allowing individuals to have more control over their movements. In the case of tardive dyskinesia, which is often a side effect of long-term antipsychotic use, Austedo works to reduce those abnormal involuntary muscle movements. For patients with these conditions, Austedo offers relief and improved quality of life. While there's no cure for Huntington's disease or tardive dyskinesia, managing symptoms effectively can make a big difference in a person's daily life. So, Austedo is a game changer for many dealing with these challenging and often debilitating symptoms. Number 3. How does Austedo work? Austedo works by targeting a protein in the brain known as vesicular monoamine transporter 2 VMAT2. This protein is involved in the transport of neurotransmitters, which are chemicals that help nerve cells communicate with each other. By inhibiting VMAT2, Austedo helps to decrease the release of certain neurotransmitters, including dopamine. This regulation of dopamine is crucial in controlling abnormal movements associated with conditions like Huntington's disease and tardive dyskinesia. In simple terms, Austedo helps to calm down the brain's signaling pathways, particularly in areas responsible for motor control. By doing so, it reduces the involuntary movements that patients struggle with daily. This action makes it a valuable medication for those experiencing these neurological conditions, offering both relief and more stable motor function. Number 4. When was Austedo approved? Austedo received FDA approval in 2017 for the treatment of chorea associated with Huntington's disease. This was a significant milestone for patients suffering from this condition, as prior to this, there weren't many effective treatments available for controlling chorea. In 2018, its approval expanded to include tardive dyskinesia, a condition caused by long-term use of antipsychotic medications. Since its approval, Austedo has been prescribed to thousands of patients, giving them a better chance at managing their symptoms and improving their quality of life. The approval of Austedo marked a turning point for neurological treatments, offering patients a more effective and targeted option. Before this, managing movement disorders was often a matter of trial and error with medications, many of which carried a higher risk of side effects. With Austedo, patients now have a more specialized medication designed specifically for their needs. Number 5. What are the side effects of Austedo? Like any medication, Austedo comes with a range of possible side effects. Some of the more common ones include drowsiness, fatigue, and nausea. These side effects are usually mild and may go away as your body adjusts to the medication. However, more serious side effects can occur, such as depression, suicidal thoughts, or severe movement problems like Parkinsonism. It's essential for patients to be aware of these risks and monitor any changes in their health while on Austedo. If you're considering taking Austedo or are already on it, make sure to communicate regularly with your healthcare provider. They can help you manage any side effects and adjust your treatment plan if necessary. Overall, most people tolerate Austedo well, but it's important to stay informed and be proactive in managing your health while on the medication. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. How should you take Austedo? Austedo is typically taken as an oral tablet, with the dosage adjusted based on the condition being treated and the individual's response to the medication. For Huntington's disease chorea, the starting dose is usually low and it is gradually increased over time to find the optimal dose. For tardive dyskinesia, the dosage may vary based on the severity of the symptoms and the patient's overall health. It's crucial to follow your doctor's instructions on how to take Austedo, as this can significantly impact its effectiveness and minimize the risk of side effects. Some patients may experience drowsiness, so it's advised to take the medication with caution if you need to drive or operate heavy machinery. Always take Austedo with food to help improve absorption and reduce stomach upset. Number 7. Are there any drug interactions with Austedo? Yes, Austedo can interact with other medications, so it's vital to inform your healthcare provider about all the drugs you are taking, including over-the-counter ones and supplements. Some medications, especially those that affect the central nervous system, can increase the risk of side effects when combined with Austedo. For instance, drugs that depress the CNS, such as certain antidepressants, can increase the likelihood of drowsiness or sedation. Additionally, other medications that affect dopamine levels, like certain antipsychotics, may not work well with Austedo. Your doctor will carefully review your current medications to avoid potential harmful interactions, and may suggest adjusting doses or trying different treatments if necessary. Always check with your healthcare team before making any changes to your medication regimen. Number 8. How is Austedo different from other medications? Austedo differs from other treatments primarily due to its targeted mechanism of action. Traditional treatments for conditions like Huntington's disease, chorea, such as tetrabenazine, can be effective but often come with more severe side effects. Austedo, on the other hand, is designed to reduce the risk of side effects like sedation and depression, while still effectively managing symptoms. When comparing Austedo to other medications for tardive dyskinesia, it offers a more focused treatment for movement disorders. It's specifically tailored to inhibit the VMAT2 protein, which sets it apart from other treatments that may not address the root cause of abnormal movements. This unique approach makes Austedo a standout option for people who need precise control over their symptoms without the added burden of harsh side effects. Number 9. What does the research say about Austedo? Clinical studies on Austedo have shown promising results, especially in reducing involuntary movements. One major study demonstrated that patients with Huntington's disease chorea experienced significant improvements in their symptoms after taking Austedo. Similarly, studies on tardive dyskinesia have shown that Austedo is effective in reducing the severity of abnormal movements caused by antipsychotic medications. This evidence has helped establish Austedo as a trusted treatment option for these conditions. Research also highlights that Austedo has a more favorable side effect profile compared to older treatments, making it a safer choice for long-term use. While no medication is without risks, the data supporting Austedo's effectiveness and safety gives patients and doctors confidence in using it as a treatment for movement disorders. Number 10. How do you manage treatment with Austedo? Managing treatment with Austedo involves more than just taking the medication. It's essential for patients to have regular check-ins with their healthcare provider to monitor progress and adjust the dosage if necessary. Patients should also keep track of any changes in their symptoms or side effects and report them to their doctor promptly. This proactive approach can help prevent any serious issues from developing and ensure the treatment remains as effective as possible. Beyond medication, managing a neurological condition often involves lifestyle changes and supportive therapies. Physical therapy, counseling, or support groups may also be beneficial in dealing with the broader impacts of the condition. When used in combination with these therapies, Austedo can play a key role in improving quality of life and helping patients regain control over their movements. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.